Good morning and welcome to another Monday Morning Mobility. I'm Jeff Blanchard and I'm here to offer you a little help from a physical therapist perspective. My goal is to help you improve your quality of life by teaching you how you might be able to decrease pain and increase your ability to move. Today my topic is good pain versus bad pain. So oftentimes I think that people are a little bit confused about pain. In fact, people don't like to even use the word pain. They would rather say uncomfortable or discomfort or sore because they believe that pain is a bad thing. And in actuality, pain is all of that encompassed. Pain can be discomfort, and it can be all the way up to significantly horrible pain. So we talk about, in physical therapy and in medicine in general, we talk about pain on the pain scale, anywhere from 0 to 10. And so I typically suggest to my patients that if they're feeling discomfort, light symptoms, that it's a lower number, so say 1 or 2 versus a higher number. There's also a difference between pain that would mean that there's a problem versus pain that just means that things are changing. So an example would be, let's say you do an exercise, and it's an exercise that you don't normally do, and the next day you are sore because you've done an exercise that you don't normally do. So we might see a patient back after a visit and they say, oh, I had a lot of pain the next day. So my mind immediately goes to, okay, what did we do wrong? Maybe we pushed things a little bit too hard. But then in further discussion, we find out that it was just soreness because they were using muscles that they hadn't used before. So that is a delayed onset of muscle soreness situation, and that is normal. So I would call that normal pain, or maybe good pain, versus a different kind of pain that would indicate that there's a trouble that's occurring and that you need to stop what you're doing. So anytime you perform an activity and you have pain at the time of that activity, and it is causing you to feel maybe a pain that you've been feeling for a while, I would typically suggest that you try to avoid that activity. And so especially if you're having symptoms and having pain that you've had for a while, let's say I'm having knee pain, and I've been having knee pain for a couple weeks. If I go and do an activity that provokes that knee pain, then usually you're asking for more knee pain. But if you go and do an activity where you work the muscles around the knee, and the knee feels okay, and the next day you have some soreness in those muscles around the knee, in my opinion, you've successfully worked the area, you've worked the muscles around the knee, but you haven't provoked the knee pain. Sometimes pain doesn't come on immediately when you do an activity. There are times where you might do something and you feel okay, but then an hour or 2 later, or sometimes even the next day, you have bad pain in the area because you did something. That is more challenging to deal with. So there are times like those where we really have to discuss and think about, okay, what did we do? What potentially contributed to the problem? And oftentimes that's more of an inflammatory situation. So you can do something that creates a little bit of inflammation, but you don't have symptoms with it. And then that inflammation builds up over the next few hours or maybe the next day. And once the inflammation builds up to a certain level, now you have a higher level of pain and you're paying for what you did the day before. And so those are situations where we need to try to figure that out and try to avoid that activity. So trying to understand good pain versus bad pain can be challenging for many people. And we oftentimes find that people, just to survive, just to get things done, they divorce themselves from their pain, and they actually create a disconnect in their mind. So to the point where they ignore their symptoms just so they can go and get things done because, well, I can't feel this pain right now, so I have to get this task done. Unfortunately, that is not a sustainable situation. Eventually, your body will force you to stop. And so it's situations like those where you want to come in and see us to tell us what's going on so we can help you navigate that. In each of these cases, if you're confused about pain, really the best case scenario is to come in and see your physical therapist. And so we can get into the reasons for your symptoms. And so we can try to help you understand, is this a good pain or is this a bad pain? Is this something that you should push or is this something that you should avoid? And how can we, I tend to use the phrase, kind of sneak up on this, how can we work on other areas to strengthen and stabilize, and so then you're able to do the activity that you want to do without getting into that level of pain. So when in doubt, come in and see us, ask us those questions. We can help you navigate those situations. So thank you for joining me for this episode of Monday Morning Mobility. If you enjoyed today's episode, please share it with a friend and leave us a review. If you have a topic that you'd like to have me discuss, please let us know. And until next time, keep moving because motion is lotion.